Hi, my name is Zoe Zwecker, and I want to talk to you a little bit about the project that I've been working on this summer with the Margolis Center. So we sort of set up the framework to conduct a geospatial analysis of pollution sources in type 2 diabetes within communities in Durham County. So just to frame this problem a little bit, Durham County is a county that's really affected by high prevalence of diabetes, where almost 13% of the adult population has diabetes, and in certain neighborhoods, this high incidence rate applies to upwards of 23% of its inhabitants. So, we really wanted to understand why there's such a strong prevalence of diabetes in Durham County. What factors are causing this? What factors are correlated to this? And it kind of requires looking at the problem from many different perspectives. So, I am a student at Colorado College where I study environmental science. So, my lens was trying to apply this geospatial framework to explore the possible correlations of diabetes with the built and natural environment. And upon further research, this sort of came down to looking at pollution sources and seeing if pollution and environmental health was at all playing into this diabetes effect in Durham County. So our first objective was to see if diabetes is related to the anthropogenic footprint. That just means like sources of pollution in Durham County. This is kind of premised in the idea that a lot of studies have linked high concentrations of particulate matter, PM 2.5, which just describes the diameter of particulate matter in the atmosphere, to certain metabolic dysfunctions. So essentially, this particulate matter can be inhaled and it lodges itself in different parts of the body depending what the diameter is. And because this is so small, 2.5, it is able to lodge deep down into your lungs and cardiovascular system and enter your bloodstream. So that's sort of why I decided this would be a cool thing to explore. The second objective was seeing how healthcare delivery and policy can be targeted to mitigate health risk. So using the geospatial lens and using that to map certain variables to discover where these high-risk places are, and drawing the links between environmental risk and health risk. So the idea here, in terms of methods, was to use already geocoded data from the Southeastern Diabetes Initiative, called SETI, that considered the burden of type 2 diabetes. This data comes, like I mentioned before, from the SETI dataset, which was conducted in many different locations in the Southeast, including Durham County. We unfortunately weren't able to access this data set during the summer internship, so we couldn't actually do these methods, but I think the geospatial framework for this kind of analysis is still really useful to think about. So the idea was to use this data and combine it with other publicly available data sources on the built environment, like roads, major highways, source pollution of industry, houses, and also concentrations of particulate matter. And this data is available through different EPA monitoring sites. So what you do is you overlay all of those variables as layers, we call them, on a map. And it sort of makes the relationships between the variables stand out more. Now, of course, we have the mapping side of the methodology, but we also have a statistical analysis part of the methodology. And what this means is really that the map allows us to visually see if things seem to be related, but the analysis allows us to adjust for many variables. And what I mean by that is when we're looking at where there's high risk in Durham County, high risk is often also correlated with low income, racial distribution, education, and other variables that are social determinants of health. So we need to run a model that adjusts for these variables so that we can really focus in on the thing that we're looking at, which is pollution, to see if it has any direct relationship with diabetes. So again, because we didn't actually end up conducting this study, these results are what we would kind of expect to see, and based on some of the research that I've conducted. So the EPA sets a national regulatory standard of 35 micrograms per cubic meter, and Durham County hovers just a little bit lower than this. And what this means is that this number is an average, so even though on average we're lower than the national standard, it's not by a lot and it's still not good. That's just like it absolutely can't exceed this quantity. So in my opinion, there's still a lot of work to be done there. And again, I just want to highlight this point that pollution epicenters are also often health epicenters where people are experiencing a lot of poor health outcomes. So that's kind of like where we're led in the discussion and thinking about health policy, the things that we can change. So again, we're trying to identify risk and then target risk in terms of mitigating health and the environment. So the things that we can really change here are, improving access to medical resources. I did a lot of research on self-monitoring sites and community health workers, but also providing natural resources like improved access to green space for areas that are high risk. And this kind of has like a twofold really positive effect, because improving access to green space is not only, helping the environment, we're allowing people to access outdoor places. Oftentimes this means getting rid of industry and replacing it with trees, grass, but we're also providing a space where people can get out and walk, which has really positive benefits for people who have diabetes. We can also work on improving infrastructure and housing. Again, this would be targeted to the areas that appear on the map to meet and exceed particular environmental standards in those areas. So, as I mentioned, our major limitation was access to data. The Duke Electronic Data Warehouse, where all of the study data is stored, I wasn't able to access. And then also having access to really accurate pollution source concentrations would improve the study a lot. I was able to get some preliminary numbers from the EPA website, but nothing too specific. In terms of future directions, we need to build the model so that we can adjust for confounding variables. I want to thank Dr. Brady Granger, who worked with me this summer. I really had a fun time.